What's up, guys? Today we're going to talk about plantar fasciitis. We'll go over what it is, the pain it can cause, and the ways of treating it.
John Tracey here from Holy Redeemer Sports Medicine. We're in Huntington Valley, Pennsylvania. You can look us up at redeemerhealth.org, sports medicine. I've been a physical therapist for about 30 years. You wake up one morning and you start walking to the bathroom and you feel like you stepped on something the night before. So you limp to the bathroom and maybe you limp back to bed or you limp and start getting dressed. And by the time you almost out of the house, it feels a little bit better. The time you get to work, it's feeling a lot better. And then after you get done work, at the end of the night, you get the same type of pain. And you say to yourself, what is that? And the answer is, it's probably plantar fasciitis. The plantar fascia attaches from the heel of your foot up to the toes of your foot. And it's soft tissue, it stretches. Most of the time, people get pain on the medial or inside part of their heel. Pain is usually worse in the morning. Like I said, gets better in the afternoon, and then worse again at nighttime. Most people have more pain when they walk around without shoes on. So let's talk about the treatment that you can do for plantar fasciitis. Number one, you can see a physical therapist or a massage therapist and get an ultrasound or some myofascial release soft tissue massage on the area. One of the reasons that your foot's so sore in the morning is that at nighttime when you sleep in a dorsiflexed or ankle down position like that. That puts slack on the Achilles and in turn puts less pressure through your plantar fascia area. When the person or physical therapist gives you the massage, they should work some on the Achilles area to loosen that up, and then they should also work on this plantar fascia area here. What I'm going to have Chris do is lay on his stomach first, and the therapist can put some heat on this before. Just use some like Eucerin cream or some kind of non-allergenic cream, and then you put a little bit of a stretch on the Achilles tendon area like this while you're doing it, and just loosen up the Achilles tendon area first. Sometimes I'll have them hold a towel if they sit up in a semi-recumbent position to keep the foot back and the Achilles stretched, like a stretching rope. Then with my knuckles, I'll just go along the plantar fascia area that's sore. I like to get in and open up the metatarsal areas as well, so the foot performs better when the person's walking. So that's the soft tissue massage, a little bit of myofascial release to the Achilles area, and then to the plantar fascia area, and also the metatarsal area of the foot. Another thing that works well with plantar fasciitis is ultrasound. So now I'm using the ultrasound in a semi-recumbent position with Chris stretching out his Achilles. And this is a form of deep heat. And you might want to do this before you do the stretching of the area. The first thing I want to talk about is a foam dowel stretch. This is actually a piece of like a water tube or like a water noodle that you would use. Sometimes people use frozen water bottles and put it underneath their feet. But what Chris is doing here is just rolling both feet from his toes all the way back to his heels to lengthen the plantar fascia area a little bit. And I usually have my patients do that for about 1 to 2 minutes and usually feels pretty good on the area. Again, after being stretched. Another thing I also like is the Prostretch. It's a product that's made in America. It costs between like $20 and $30 on Amazon. What you do with that, you can be watching television and you just kind of bring it back into a dorsiflex position like this, and then just try to relax your leg into that dorsiflex position. You'll feel your Achilles area here stretching, and then sort of let the air out of the tire and let it stretch for about 20 to 30 seconds. Then take a break and then do it again. And you can work with this for about 2 or 3 minutes. What we have here is an incline stretch. I don't know who made this product, but they're all over the internet. Chris is working at about a 45-degree angle right now. And you just want to take it to a position where you feel a gentle stretch. And once you get to that position, a lot of times I'll have people do this for a full minute because it takes them a little bit just to relax into the stretch. So if this is too painful at 45 degrees, we can move it down a little bit to about a 20 to 30 degree angle and then start with that. It's fine to start out with a runner stretch to stretch your Achilles area. Find something that you can support your body weight on. Make sure that your feet are not turned out, they're sort of turned in, or just straight facing the object that's supporting you. And then lean into the stretch, keeping your back leg straight. The last thing that I'm going to talk about here with plantar fasciitis is your foot support, which may be the most important thing to help with your recovery. First and foremost, you want a shoe that has some arch support and that has a little bit of a heel. Puts the foot up in like a little higher position in the back, and it takes some of the pressure off of that Achilles tendon. If you're in a lower shoe, not like this one, you can see that when this sits flatter, there's more pressure through the Achilles tendon, and therefore more pressure through the plantar fascia area. Another thing I recommend is always wearing your shoes. When you get up in the morning, first thing you do is put your shoes on. And you're going to have to walk around your house with a pair of shoes. So if your significant other says to you, I don't want you wearing your shoes around the house, then just get a separate pair that you're just going to wear in the house that's going to have a higher arch that'll take away some of your pain. The third thing, and also another important thing, I usually don't endorse a lot of products, but this product does work. It's the Bauerfeind ViscoSpot Heel. Looks like this. And I've had patients that have problems with plantar fasciitis for a long time, and then when they put this in their shoe, miraculously it gets better. Hopefully this helps you, and thanks for watching.
If you guys have any questions, leave them in the comments down below. Have a good one, and I will see you guys in the next video. Peace.